Hi everyone, it's Nurse Dayna. I wanted to take a minute and just quickly review our food intolerance test that we use at SeeBeyond Medicine. I just wanted to show what it is, what we're really looking for, and help answer any questions that may come up for you. You can always email or call, and I'm happy to review even more. But quickly, what we're looking for is 88 different foods that you'll see in the left-hand column. And what it's telling us for each food, this is a blood test, by the way. And what it's telling us is really two main things at the top. There's the allergy or the sensitivities. And basically it's telling us if you do have an intolerance to the food, it's either going to show up as an IgE, which is histamine antibody, if your body is producing a histamine antibody in reaction to the allergen. And that could mean anything from hives, trouble breathing, congestion, itchiness, anything you would associate with like an actual allergy symptom. And typically you're going to have that reaction from an allergen within 1 or 2, 3 hours after exposure. If we move on to these other columns over here that say IgG4, IgG4%, immune tolerance to IgE, these columns are telling us a little bit more about how active your immune system is. Normally IgG4 is like a good thing. It's like your immune system is protecting you. And if we do see this yes kind of be popping up a lot in someone's test, then perhaps your immune system is just a little too taxed. It's a little too burdened by reactions to some of these foods, or blocking histamine to some of these foods. So definitely a big piece. One of the bigger reasons that we do use this test is to actually include this whole section that tells us a little bit more information about somebody's reactions to food. And then over here is sensitivities. On this right-hand columns over here is IgG and C3d complement. Sensitivities become a lot trickier to identify. One of the reasons is because the symptoms might just be so vague. Like you might eat something and just get tired. You might eat something and get brain fog or bloat, or just something that you might not ever think, oh, that must be from something I ate. The other thing with sensitivity is it can take up to 3 days for your body to actually, react and have the symptoms. So it's, again, just so much harder to identify. And one of the bigger reasons we really love this like real data. I ate this food and it's causing, an inflammation. It's causing an immune reaction in the body. One of the most important things I want to make sure all of my patients know about this test is it's very controversial. And the reason is that it's not perfect. You might have heard of leaky gut. Leaky gut is essentially intestinal impermeability, meaning toxins and food particles leak out of the gut where it should not. And why this test can be very controversial is some foods that you eat often might be leaking out if you do have a leaky gut and popping up on this test. So very often when I'm reviewing this with patients, I'm going to give you an example. Like if you look at this page, if there's a lot of foods listed in red, like many foods, it's not that the person is actually intolerant to all of these foods. It's more of an evidence of this person has a very leaky gut. And the food particles that are coming up on here is more because the food is leaking out and the immune system is reacting, saying this is a foreign invader. And it is challenging when this happens, because it's kind of like, okay, well, what foods are actually intolerable? But it also helps us really guide healing the gut and really seeing what sort of level of inflammation and what's really going on inside the gut. So it is something that you'll probably read about if you start looking up food intolerance testing. It is a very controversial thing, but it is so helpful in identifying like what is really causing reactions right now. That's the other piece of this, is it might not be foods may not affect you the way they affected you 5 years ago, or in a year. Your kind of microbiome and your gut, the integrity of your gut lining, and things that are going on in your life, stress, antibiotic use, taking Advil, or pregnancy, or there's so many things that affect the gut itself, that this food intolerance test is not, it can evolve. Like I, have seen people multiple times do this test, and it looks different every time. There might be some similarities on like true, food intolerances, but it is very subjective to like kind of what's going on at the time of the blood draw. So I don't know. I hope that answered some questions, or helped explain this a little bit. But it is so useful figuring out a little bit more on what exactly you should eliminate in your diet. A lot of times you're like, I need to go on an elimination diet, but you don't know what. It could be gluten, which is pretty obvious for a lot of people, or it could be avocado, which is not, or tomato, or cucumbers, or something that you would associate with being super healthy. It could be flaxseed. I mean, I've seen really healthy food affect people, and you would never know unless you kind of have some answers. So here is a test that would give you some answers. Again, I hope this is helpful, and would be happy to answer any questions if anybody has any. All right, thanks.